whether your goal is to run a marathon or an ultra, hike up a mountain, complete an Ironman, or simply be able to play with your grandchildren, we work with our athletes to develop our results-driven, evolutionary biology-based approach, which has led to groundbreaking science like the FASTER study. We translate what we learn from our innovation and pioneering work at those outer edges of competition to guide people on their journey to higher health and peak performance. Recently, I posted a blog about why we humans compete. And while competition is deeply rooted in evolutionary biology, in our evolutionary biology, we have largely failed at making our health better. And it's no wonder. Humans have harnessed competition as a tool to make our lives more convenient. So while our vehicles and other things in our lives continue to make these amazing advancements driven through competition, we continue to slide down that slippery slope of bad health. And unfortunately, the competition in healthcare is for new interventions and drugs to treat disease, and that really savage competition for billions in research and development funding to study, publish, and develop these interventions. Unfortunately, at the clinical level, the situation is degraded to the point where honest, caring, and overworked, hardworking healthcare professionals do nothing but treat disease at the reactive and acute level with procedures and pharmaceutical tools developed out of the very urgency to keep people alive. Now, is this how we are going to guide ourselves to getting healthy? You know the answer. Okay, as the past 2 years demonstrate, the challenge is it's almost impossible for us to divorce ourselves from expert advice and the standard of care, even when it has become outdated or needs a shaking up or is just plain wrong. We cling to that institutional security to hedge our bet, and in doing so, we settle for less than what is optimal for each one of us, the individual. And this includes nutritional, exercise, and lifestyle advice generated from a system treating acute disease. And as much as we would like to believe the current system is focused on preventing disease, especially the biggies like diabetes, heart disease, cancer, and the past 2 years, of course, the real results and data show precisely the opposite. Focus and think about the end result, rather than get distracted by all the peer-reviewed saber rattling of the science on that disease du jour. This is all done to advance an agenda or point of view, or even more sadly, build a following. Then think about it on an individual and selfish level to ask yourself this: do you really think you are going to get optimally healthy by getting the bulk of guidance from a system treating sickness? Or would it make more sense to look at what supremely healthy individuals are doing? Those who are competing at the highest level of sports, and especially those who continue to compete as they advance in age, all while living robust and engaging lives on all levels. I don't have to tell you the answer. No mansplaining needed. You know. It's obvious when you look around at the supermarket or at work, and the vast majority of athletic competition has yielded nothing better in terms of better health. That is until now. This is why you are here. This is one reason our athletes, my team of coaches, and I compete, develop, and learn. It's to improve human health as an integral part of human performance. We work with our athletes to develop our results-driven, evolutionary biology-based approach, which has led to groundbreaking science like the FASTER study. More importantly, we translate what we learn from our innovation and pioneering work at those outer edges of competition to guide people on their journey to higher health and peak performance. So whether your goal is to run a marathon or an ultra, hike up a mountain, complete an Ironman, or simply be able to play with your grandchildren, all while avoiding medications, a restrictive diet, or an exhausting instead of an exhilarating exercise program, you have arrived at the right place to start your journey to metabolic freedom.